Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Prather Chiropractic Services in Lafayette, Louisiana. Today, Chris is here to get his first decompression adjustment. Now, we've treated Chris in the past. You came in initially, about how long ago? Chris, about 6 months maybe?
It's been 6 or 7 months.
Yeah, 6 or 7 months. Original complaint of headaches that
Correct.
began when you were...
I was in the military.
You were in the military.
Yes, I joined in '97. First major issue started around 2001.
And we appreciate your service, by the way. We
Thank you
appreciate
very
all our
much.
veterans over here at Prather Chiropractic. Thank you for y'all's service. Now, you suffered a neck injury during training where it was a hyper-flexion
Correct.
injury. You were doing hand-to-hand combat training.
Correct.
And you were in like a rear naked choke. You bend over and the attacker comes over your head,
Yes.
flexing your head down.
Yes,
So-
we were doing grappling training, and I was in a seated position, and the person I was training with was behind me, had me in a basically a rear naked choke, rose up over top of me, and I was hyperextended forward and pulled everything
Yeah.
in my neck forward. And
So you started getting these
Yes.
headaches, these cervicogenic headaches,
Mhm.
migraine headaches from that since then.
correct, that was basically the start of the issues.
Yes. And then subsequently being in full gear, full pack, doing a tour in Iraq, walking around with all that gear, dealing with heavy munitions.
Heavy munitions as an artilleryman, yes, and a total of 9 years in service with the full gear, the Kevlar, the flak jacket, the pack that you have to wear. It's a lot of weight, it's a lot of wear and tear on the body,
That's it.
and just over time.
The miles add up.
Correct,
And the
correct.
pressure adds up. So all of that was doing squish to your
Yes.
spine.
Yeah, it was
compressing
squishing the spine and
Mhm.
stretching the neck in ways that it wasn't
Yeah.
supposed to go.
Right.
I also had a special needs child who my wife and I recently lost about a year ago, who had gotten to 16 years of age, size of a full 16-year-old child, but was over 100 pounds. She was
Mhm.
non-ambulatory. My wife and I had to cradle her like an infant child to get her around from her wheelchair to her changing table to the bath to bed, which puts an awful lot of strain on the body when she's unable to assist us in lifting. My wife and I would help each other move her around,
Yeah.
but when you have to pick her up with a solo lift,
Right.
that puts an awful lot of strain on the neck. And just through the years, basically from 21 years old to 40, that's a lot of strain, a lot of torture.
Tremendous. So you've already put your spine through the ringer, it sounds like. But
Yes.
hopefully we can correct that with the ring dinger. Now,
That's the hope.
that's the hope. So we've been treating Chris with Gonstead adjustments, had some good success. We've gotten a lot of improvement in those headaches, but now we're able to perform the decompression procedure and hopefully get another level of improvement and lasting improvement with your spine. What I'm seeing is patients are getting more stay put value out of their adjustment since we've been able to include this Y-axis decompression. Now, what's also interesting is you've been watching Dr. Johnson's videos for
Probably 4 or 5 years.
Yeah.
I started watching these
that's pretty
videos
amazing. That's pretty amazing.
On YouTube
Right.
before I started coming to
Yeah,
see you.
yeah. So
I've been a
that's
fan of the ring ding videos for a long time.
Yeah, it's amazing. So I got certified in December of 2020, and I just got my equipment in about a month ago. So we've been able to roll that in to patient procedures, and I've been seeing some amazing results already. So
Been
I'm
looking forward to it.
real eager to include that for you. All right, ready to get started?
Let's get cracking.
All right, man. We can go face down right here for me, Chris.
Okay,
Let me start with our biophysics table.
Remove my glasses.
All right, now the goal here is to adjust everything and stimulate everything. Get as much neurological input going into that brain as we can, and that's going to send a signal back down to your spine to help your body adopt this new configuration of movement. It's pretty good there. Any tightness in the lower back when we do that?
Nope.
Just a little bit in the front of the legs. It's pretty even. Any sensitivity here in the sacrum?
Right there.
Yeah.
Yep.
L5 a little bit. I feel a little pocket of fluid in there. That's inflammation. Checking your spinal tone. A little bit there, but inflammation there. When a joint moves wrong chronically, it gets inflamed. That's the histological response to it. And fluid and inflammation can accumulate in that joint space, and we can feel that. The joint almost feels mushy versus like a basketball with the right amount of air in it. That's a healthy joint, has a buoyancy to it and a tautness. But when that joint kind of feels like mashed potatoes, that's inflammation. Alrighty, sir. We're going to start in the sacrum, work the pelvis, up through the lumbars, thoracics, into the cervicals, okay?
Okay.
Table's going to kick up. Okay, heavy push here. There we go, Chris. Good. Good release there. Okay, now we're going to move into the cervicals. Table's going to kick up. Okay, let's scoot you down just a tad, sir. All right, I'm going to tighten this. All righty, roll it on over to your back. Okay, so far so good. Okay, now we're going to be adjusting the head back over the shoulders. Let's get the hands like so. Table's going to kick up. Okay, going to take your arms and hold them out wide, just like this. Chest piece is going to kick up. We're going to work on those shoulders, clavicles, rib cage. Okay, hands on the tummy for me. Decompress this leg here, Chris. Really good. All right, very good. Okay, let's sit you up, Chris. Sit up. That's it. Spin this way. All right. It's a bit of a workout, huh? Dangle. Okay, good. And here, let that arm dangle. All right. Did you pass through some rain driving in?
Not too much.
You come from Jennings or
Yes.
car? No.
Coming from Jennings.
Okay, there we go. Everything cracking.
That's a good thing.
Yeah, it is. All right, there we go. Man. Move it on over to the decompression table. All right, Chris, gonna have you hop up right here, and then lay flat on your back and head this way. That's a man. Okay, I'm gonna get your phone off there. Does that come off pretty easy or no? Okay.
It's
There we
just
go.
the case.
Just in case. I didn't want to smash it.
There you go.
Okay, I'm gonna get that spine in neutral by elevating those legs. All right, so just dead leg it for me. Let the table lift. Look at there. He's jumping. Go a little higher on you. There we go. All right, here comes the pins. That's to stabilize the pelvis. Keep you from sliding. Be in the fleshy part of the side. Tight squeeze here. There's an art to this pinning stuff that I've learned. Just breathe through the nose. Let the pin sink. All right, very good. Okay, sir. And keep those back teeth touching. Breathing through the nose. Wiggle the fourth toe. Breathe, breathe, breathe. Keep breathing. Now, you should have felt that go to the belt.
Oh yeah.
All the way down. So you've been watching ring dinger videos for 5 years, and that was your first one. And that's about the reaction I had on my first one too. It's massive, and it's awesome. Okay, let that settle in. There we go. I'm gonna finish releasing the neck. And there's just nothing left there. Everything's bled dry. Awesome. You tolerated that pretty good.
That felt good.
All right, let's get you up, my man. Spin it around. Okay, I'd like to get your reaction. Tell me what you felt. That pretty much says it right there. Huh?
You know, for the past maybe 3-4 years, usually, and I believe we discussed this when I first started coming to you, I always feel like I had a knot right here in my neck. And this is the first time in a long time I don't feel it.
Don't feel it. We got it to release.
Yeah.
Yeah. It's
Yeah.
being able to adjust on that different plane, that different vector of movement.
Oh yeah.
Good, man.
So that was a definite release.
Yeah, major. Well, hopefully that'll, like I said, translate into you feeling better. I mean, it should. It should. Get rid of those headaches for good. All right, man. Well, you might be sore. Manage that with the ice, like we talked about. Crushed ice in a Ziploc bag and stretch it out.
Oh yeah.
All right, and we'll repeat that a couple of times a month, till it clears out. Well, thanks for letting us record the encounter, man.
Absolutely.
Appreciate you sharing your history with us.
Absolutely. That's definitely worth it.
If y'all like this content, please, if you think this information can help somebody that you know that's having pain or having challenges, is curious about chiropractic, or if it can help them, please like the video, subscribe to the channel, share it with your family and friends, or somebody that you think we can benefit. So we're trying to expose people to what we're doing here, and so we can help people feel better and live healthier lives. So this is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.